The traditional surgery, they have to, they separate your surgery, they actually cut your sternum in half. So it goes from the top of your sternum at the top of your rib cage, right about here, to the bottom of your sternum. So it's, this long, and that's a cut through bone, right up through the middle. And then they use I think it's called a rib spreader, where they actually open your rib cage this way, and then they have access to do the heart surgery. Now, on the minimally invasive, they go between the ribs, and they make an incision that's maybe, in my case, it was 9 centimeters long, or just between 3 and 4 inches long, between two of the ribs. And then they spread the ribs open this way a little bit, so that they have access. So it's pried apart this way. So your ribs are a little sore when you're done, and you're not. I don't want to make people think that it's totally pain-free, but and you got some little bumps and bruises, from that procedure. But certainly this heals a lot faster. They don't have to cut any bone. You have kind of a tingling sensation, almost like when your foot goes to sleep, you feel this tingling. Well, that's if you press on your chest. That's what that feels like from the nerves that they have to damage when they're going in and making the incision. But that's already quite a bit better, and that's just a matter of time before that all goes away too. But no, I think in the past when they did this incision and went through the breastbone, I was told most patients it was 8 to 12 weeks before they would be able to run at all with that incision. And yeah, maybe not quite so successfully, but they had me up on there in the 3rd week. So it went much faster. And what they found was, I think with the old traditional procedure, by the time your chest healed from the cutting your sternum in half, your heart was probably ready for the rehabilitation. Your heart was ready to go because it took that long to heal the rest of the body that had been damaged to get at the heart. And with the minimally invasive procedure, we had to wait for the heart. The heart surgery was the same surgery that it is with a different access method in the old way. But the body felt ready to go, but the heart really needed its recovery time. So I pretty much was on the shelf for a few weeks just waiting on the heart to heal. But that's just, it's relatively pain-free. It's not uncomfortable. You just notice your heart beat going faster with it, if you exert yourself. So you have to kind of just take it easy. But it's not uncomfortable. Well, I guess because I have a family history of heart disease, and my parents have both had open heart surgery, you kind of deep in your mind know that someday it's going to be your turn. It's a genetic process, and even though I try to take care of myself and eat right and exercise, sometimes genetics just wins, and so you just have to say, okay, the genetics got me, and it's something we need to get fixed. And I really feel like I've got a second lease on things here. I told Dr. Rabindra that my first set of arteries lasted me 54 years, and I was expecting 54 more out of this set. And I said, once we get to that point, we're going to call it good.